Hello, welcome to WebsterOrthopedics.com. My name is Joshua Richards. I'm a hand, elbow, and shoulder surgeon. Today I'm going to talk about what I would like you to do after your carpal tunnel surgery. The most important part of carpal tunnel post-operative management is to make sure you do not get finger stiffness. There's basically two things to ensure that. One is to keep your hand elevated above your elbow and above your heart. One simple way is like this. Keep your hand above your elbow. You can use pillows, 2 or 3 pillows to prop your hand up. You can do it on an armchair, which is another simple way. And if you're lying down, to use 2 or 3 pillows under your hand and maybe one about under your elbow. At nighttime while you're sleeping, it's best to put 2 or 3 pillows on your left, 2 or 3 pillows on your right, so that if you turn in bed, your hand ends up still above your heart. The second thing is that we want you moving your fingers. So every hour that you're awake, you get your fingers to touch your palm. If you have to push those fingers to touch your palm, that's okay. You're not causing any harm. The most important thing is that when we see you at your first post-op follow-up, that you can make a full fist with no problem. And again, the way to do that is to keep it elevated for 2 days, and then every hour you're awake, get those fingers to touch the palm. As far as the dressing, we'd like you to keep that clean and dry, thus you'll have to put a bag over your hand when you shower, keeping the water away from your hand, keeping your hand elevated. If you'd like to clean your fingers, you take a washcloth, wring out the water, and then clean your fingers individually, not getting the dressing wet. At day 5, you can remove the whole dressing. You could shower, wash your hands, just no soaking of the wound for 2 solid weeks from the time of surgery. After washing, you pat it dry. For the carpal tunnel surgery, there'll be a cut either here or here. In an open procedure, the cut would be here. In an endoscopic, it would be here. Either way, Band-Aids will cover the wound fine. I like the larger rectangular Band-Aids that have adhesive around it all the way. So in summary, keep your hand elevated 2 to 3 days, make a fist every hour even if you have to push those fingers in, and keep that dressing clean and dry for 5 days. At your post-op appointment, we will remove the stitches. It's usually around 10 to 12 days. And remember, no soaking or dirty dishwater for 2 weeks. Thank you.